This podcast is for informational and educational purposes only. It is not medical advice and should not replace consultation with a qualified healthcare professional. Always do your own research and talk with a licensed provider before starting, stopping, or changing any supplement, peptide, or therapy. Glow peptides have been gaining attention for their unique role in supporting skin health, tissue repair, and overall vitality. When people talk about glow peptides, they're usually referring to blends that combine multiple peptides known for their cosmetic and regenerative effects. These blends are designed to improve skin elasticity, hydration, and healing while also promoting a youthful appearance. Unlike single peptides that focus on a narrow function, glow blends often bring together different compounds such as GHK-Cu, BPC-157, and TB-500. Each of these has its own properties, but when combined they create a synergistic effect. One of the most notable peptides often included in glow blends is GHK-Cu. This is a copper-binding peptide that naturally occurs in the body. Research has shown that it plays a role in wound healing, collagen production, and even gene expression linked to tissue regeneration. People who use GHK-Cu in topical form often report smoother, firmer, and more vibrant skin. When injected, it may support deeper repair and systemic rejuvenation. Because of its copper-binding ability, it also assists in angiogenesis, which is the formation of new blood vessels, helping tissues receive more oxygen and nutrients. BPC-157 is another important peptide frequently included in glow blends. Derived from a protective compound found in gastric juices, BPC-157 is known for its ability to speed healing, reduce inflammation, and repair tissues ranging from muscles to tendons and ligaments. When applied to cosmetic uses, it supports faster skin recovery, reduces redness, and promotes overall resilience. Many people report that wounds close more quickly, scars fade better, and their skin looks healthier over time. TB-500, also known as thymosin beta-4, is another regenerative peptide sometimes included in glow blends. It has strong healing properties, particularly in terms of cellular migration, tissue repair, and reducing fibrosis. Fibrosis is scarring at the cellular level, so minimizing it helps maintain smooth skin texture and healthy tissue. Like BPC-157, it also enhances healing of injuries, but adds an additional layer of regeneration that can complement both cosmetic and structural goals. When these peptides are combined, the effect is more than the sum of their parts. GHK-Cu boosts collagen and blood flow. BPC-157 reduces inflammation and accelerates healing, and TB-500 enhances tissue regeneration and mobility. Together, they create a blend that supports glowing, youthful, and resilient skin while also promoting deeper healing and overall tissue health. That is why glow peptides have become a favorite in the anti-aging and bio-optimization community. Another aspect worth mentioning is how glow peptides are administered. Some people use them in topical creams or serums, while others prefer injectable versions for stronger systemic benefits. Topical applications can target skin appearance and localized repair, while injections may deliver more comprehensive effects across the body. For example, someone recovering from surgery or injury might benefit from injections, while someone focused purely on cosmetic improvement may prefer a topical approach. It is also important to talk about how glow peptides might work over time. Users often report that results are not instant, but build gradually with consistency. This makes sense because collagen remodeling, angiogenesis, and tissue regeneration are slow processes in the body. It can take several weeks or even months of consistent use before the most visible results appear. Patience and adherence to a protocol are key to unlocking their benefits. Glow peptides may also support antioxidant defenses in the body. For example, GHK-Cu has been shown in studies to upregulate genes linked to antioxidant production, meaning it helps the body protect itself from free radical damage. Free radicals accelerate aging by damaging cells and tissues, so enhancing antioxidant activity is another pathway through which Glow blends promote youthful appearance and resilience. It is equally worth noting that these peptides are not just about beauty. While the cosmetic benefits are often emphasized, their role in deeper tissue health is just as important. By reducing inflammation, enhancing repair, and supporting vascular function, Glow peptides may help athletes recover faster, support people dealing with chronic injuries, and provide a tool for those managing long-term health conditions that affect tissue repair. Because Glow peptides are relatively new in mainstream wellness, research is ongoing. While individual peptides like GHK-Cu, BPC-157, and TB-500 have published data, their combined effects as Glow blends are still being explored. This means that much of what we know comes from anecdotal reports, user experiences, and smaller studies. Still, the consistency of positive outcomes across different groups suggests that these blends have real potential. Another consideration is dosage. Since Glow blends include multiple peptides, users should be cautious with amounts to avoid overloading the body. Following standard dosing guidelines for each component peptide is recommended, and blending them should be done with careful measurement. Some companies provide pre-mixed vials of Glow blends for convenience, but others may sell individual peptides that users combine themselves. When mixing, sterile technique, proper reconstitution, and correct storage are critical to maintaining safety and potency. Glow peptides also fit into a larger philosophy of bio-optimization and anti-aging. They are not a magic bullet, but when paired with lifestyle factors like good nutrition, exercise, sleep, and stress management, they can amplify results. In other words, they work best as part of a holistic approach to health. Peptides can support the body at the cellular level, but environment and lifestyle choices determine how well those benefits are expressed. Looking into the future, Glow peptides may become a cornerstone of regenerative medicine. Their applications go beyond skin care into wound healing, surgical recovery, and even neurological support. Already, some clinics are experimenting with using Glow blends as part of post-operative recovery protocols, helping patients heal faster and with less scarring. Others are exploring their role in autoimmune conditions, where reducing inflammation and enhancing tissue repair can improve quality of life. Of course, like any peptide therapy, safety should always be considered. While these compounds are generally well tolerated, potential side effects include irritation at the injection site, allergic responses, or systemic reactions if the body does not tolerate them. This is why professional supervision and responsible sourcing are crucial. Always verify that peptides are coming from a reputable vendor with third-party testing to ensure purity and authenticity. Another interesting point is the psychological effect of using Glow peptides. Many users report not only physical improvements, but also increased confidence, motivation, and sense of well-being. Feeling better in your own skin has a profound impact on mental health, and this psychological boost can reinforce healthier habits, creating a positive cycle. Glow peptides also raise interesting questions about the future of cosmetic procedures. While traditional methods like Botox or fillers alter appearance mechanically, peptides work by stimulating the body's natural processes. This approach may offer more sustainable and holistic results, since the improvements come from within rather than being externally imposed. Over time, this could shift the beauty and wellness industry toward more biologically aligned therapies. Another layer of potential comes from combining glow peptides with other supportive therapies. For example, pairing them with stem cell treatments, red light therapy, or microneedling may enhance their absorption and effectiveness. Each of these strategies works on different pathways, and when combined, they can create powerful synergistic effects. Clinics and biohackers alike are experimenting with these combinations to find the most effective protocols. For individuals considering glow peptides, it is useful to track progress carefully. Taking baseline photos, keeping notes on skin texture, wound healing, and overall wellness can help identify whether the peptides are working as expected. Because changes happen gradually, it can be easy to overlook small improvements until you compare over weeks or months. As with many emerging therapies, the key is balance. Glow peptides hold great promise, but they should not replace fundamental aspects of health like good nutrition, exercise, hydration, and stress management. Instead, they should be seen as a supportive tool that enhances what you are already doing for your body. In summary, glow peptides are a fascinating blend that combines the healing and regenerative powers of GHK-Cu, BPC-157, and TB-500. Together, they promote skin vitality, accelerate tissue repair, reduce inflammation, and enhance overall resilience. While research continues to expand, user reports and clinical interest point to their potential as a cornerstone of regenerative and anti-aging therapies. This podcast is for informational and educational purposes only. It is not medical advice and should not replace consultation with a qualified healthcare professional. Always do your own research and talk with a licensed provider before starting, stopping, or changing any supplement, peptide, or therapy. Thanks for listening. Keep learning and stay curious.